Alright, so to see everything that happened to me regarding my injury, please see my YouTube channel, My Medical Nightmare. Alright, so day 3. And this Cahaba Village American Family Care, this place is not professional. The first woman that I speak to, she did not take down any of my information. And then I'm put on hold while she tells me she'll go and say something to the doctor. But then I'm transferred to a third person, and this gentleman, he identifies himself simply as Sadler. And he initiates a conversation with me as if, he had my information had been introduced to me, okay? And he didn't ask me my information either. Yet he thinks he knows who he's talking to. And that's because of what happened to me at this American Family Care Clinic. This is very serious. Okay, so major critique with American Family Care. The staff in these clinics, they go by a single name. At the Parkway East location, I talked to someone named Prince. So here there's a guy, his name is Sadler, and I also spoke to a girl, her name is Astro. You're in a job where you're dealing with the public, you're working in a medical clinic, you need to go by your first and last names, your real name. There don't need to be any code names. I told Sadler this in the next call. Hey, yeah, you go into like Hooters or something, okay? The barmaid, if she's female, you often see a single name on her name tag. And most of the time, this is not their real name. And the reason for this is because, if you're a female bartender, the male patrons will hit on you a lot, try to pick you up, ask you out on a date or something like that. In the medical service setting where you're dealing with the public, this is not acceptable. The reason for this is very simple. If you're a patient, you have problems, okay, you go back into this place and you ask for one of these code phrases, they can simply come back and say nobody by that name works there. So then what have you got? You got nothing. This is why these medical employees, and they have a gigantic responsibility when they're dealing with the public. They need to give their first and last names.
Welcome to American Family Care. The right care, right now. Let's see, how can I help you?
Yes, ma'am. I'm trying to get in touch with Dr. Blake Thomas.
He's currently with patients. Can he return your call?
Yeah, this is the third day I've been trying to call and talk to him. If I came down there in person, would you let me talk to him?
In order for you to talk to him, you would have to schedule an appointment, sir.
Okay, why won't he call me back? I got a misdiagnosed x-ray here.
I'm not sure, sir. I'm not exactly sure what the reason with your call is either. I haven't been here the past few days. But I can... What was the reason? What do you need?
What do I need? I was misdiagnosed and your doctor's name appears on this report. I had head trauma, broken skull, almost died from this injury. Need it to be corrected, please. Sure.
This x-ray taken, yeah.
Okay, yeah, this was 2019.
Alright, let me go and see if I can get to him. And see if he can keep... You said you've already called up here?
I've been calling for the last 2 days. This is like so important.
Yeah, I understand. Yeah, I feel you. Here, give me one.
Yeah, the way it seems is the doctor's trying to avoid me, and I want to know what's going on with this stuff.
I doubt that's the reason, sir. But let me go ahead and speak to him.
AFC Cahaba Village, how can I help you?
Yes, sir. Who am I speaking with?
My name is Sadler. I'm the office manager here.
Okay.
Cahaba Village location.
Yes, sir. I was waiting to talk to Dr. Blake Thomas, MD.
Okay. I believe the lady up front was talking with you, and I heard her say that he's in clinic, and that is true. So, is there anything I can help you with? I think they've mentioned your name before, and I think I have something right here from you. From them when they've passed me some information.
Well, that's interesting because she never asked me for my name or my information.
I guess because you called the other day as well. I think you called the previous day or something like that, maybe.
Well, don't you guys get a lot of calls?
We do, yes, sir.
Okay, so how do you know who you're talking to?
Right now?
Yeah, I mean, you ask me for my name and my information.
Yeah, I believe you that she mentioned that what you were calling about, and it rang a bell to me that you had called a previous day, and it reminded me that I had some information.
What do you think I'm calling about? What am I calling about?
You're calling about an X-ray that happened 3 years ago?
Is that an issue? I almost died from that injury, and I was misdiagnosed. You trying to insult me?
No. I was not insulting you. No, I was saying that's what the X-ray that you were, like the incident that happened 3 years ago. That's what you were calling about.
Yeah, it's an unresolved issue as well.
Okay.
So you want to know why I'm calling today?
Sure. Yes, sir. I'm trying to help you.
Okay, let me ask you a question. How can you help me? How do you help patients who are misdiagnosed usually?
Usually, I take your information down, I pass it off to who I need to talk to, and try to push it up the chains, and see who is available to do that, and who needs to be the one that needs to facilitate that.
Okay, well, I'll give you a summary of what happened to me. No problem. All right, so 2019, it was May, to American Family Care. That's Parkway, Roebuck, Birmingham, Alabama. I had very serious neck pain. I thought my neck was broken. So I went into AFC. I paid $175. I saw nurse Kimberly Kelly. And she directed me to have an x-ray done. Had the x-ray done. She stuck her head in the waiting area. Told me I was good to go. I had no injuries that showed up in this x-ray. Okay, I'm sitting there and I know I've got a broken bone somewhere in my neck. And I protested this. I brought this up to her. I was told to go to Cooper Green Hospital if I needed further treatment. So I got the copy of the records, all right? And here's what's interesting about those records, okay? Experity Doctor Anna Maria Eknick, MD-DABR. She's not in Alabama. She looked at this x-ray scan for American Family Care. And in her report, she also said I had no injuries. Now here's the issue. In those x-ray pictures that were taken at American Family Care in Birmingham, all right, there appears a very serious head trauma, broken skull, bone injury in the basilar area of my skull. It's in the occipital condyle, condylar canal, possibly my foramen magnum is also fractured. This is a very serious injury, and I almost died from this. I was misdiagnosed in this visit. Let's get to Dr. Blake Thomas. This doctor's name appears on my records as the supervisor to this nurse, Kimberly Kelly. Okay, that's why I want to talk to Dr. Blake Thomas. So this x-ray was misdiagnosed. I need to have this original x-ray acknowledged and as well looked at again, please.
So how did you? So you went to? Did you go to to another doctor after?
Okay. Okay. Look, it's like. Yeah, I've been to a lot of doctors and hospitals, sir. I'm not talking about any other doctor or hospital. I'm talking about Blake Thomas, Kimberly Kelly, Anna Maria Eknick, and American Family Care and Experity Teleradiology. That's who we're talking about today. There's a error that appears here, and it's on you guys. You guys are responsible, and you need to do your job correctly. Acknowledge that you did something wrong here, the error, and you just need to make this thing right. And I've already talked to people about this there. I've already answered these questions.
You saw Miss Kimberly Kelly, right?
Yes, sir.
Had the x-ray done, all that stuff. Visit was completed, and you were referred out to another doctor. Is that what happened? And you went to another doctor?
Yeah, yes, sir. Well, what's interesting about that visit is I was told I had no injuries. The radiologist came back and said that I had no injuries in the report. But here's a strange thing. If I had no injuries, I was then referred from this visit to an orthopedic doctor, bone doctor, and a neurologist. So if I didn't have any injuries, why was I given these referrals? And that tells me that, maybe something's going on that I'm not being told about.
Okay. Yeah, I mean, if they referred you out, I mean, that's not indicative of you having an injury. It's just that, we send you to specialists that are more specialized in dealing with, your issues that or the complaints that you had that day.
Okay, well,
You say, I've got
okay, but I mean, again, if I don't have injuries, why do I need to go to a specialist? It's $300. That's a lot of money to someone such as myself, sir.
Who did you see after? Who did you go to after leaving Parkway? What was the doctors after that?
Who was I referred to?
Yes, I mean, who you referred?
You should have that information in your records, right?
Yes. Okay. So yes, you were referred to a neurologist. Let's see. Referred to a neurologist, and then was let's see. Reading through here. Okay. After your visit, it was notified a patient to follow with ortho if pain persists.
All right. Yeah, I went to the orthopedic doctor. This is Perry L. Savage Sr. at Ortho Alabama Sports. Is that down there near Trussville? This visit, this was a total waste of time. And I took in other CT images and MRI scans that I had done around the same time, and he looked at these images and with a straight face and told me that I had no injuries in these images, as well as the AFC X-ray. That the injury, it appears in that X-ray, and that's why I want to call and talk to the doctor, Blake Thomas, because if he's a doctor, he can look at those pictures and he can say, yeah, there's something there. I can see that.
All right, so. You say, okay, so I got it down that our images do show the injury.
Yeah, they do.
Dr. Davis Stern, who was the CEO of Xperity Radiology.
Called in. Yep.
You went so after Dr. Savage, he looked you over and said you got no injuries. Who did you go to after that?
Yeah, I also went to the neurologist, Kyle Hudgens, MD, Grandview Neurology.
So he's at Grandview?
Yes, sir. $300 visit, cash. Yeah, so when I went to Kyle Hudgens, I also took in all the pictures, okay? I took in the images on the CD, took in the American Family Care images, took in other MRI, other CT that also show the same injury area. So Dr. Kyle Hudgens, he looked at my pictures as well, and he examined me. And he also said that he thought I had just strained my neck, and this is not the case.
Okay. So he said no injuries as well?
Yes, sir.
Okay.
I was referred by AFC to those doctors. Those doctors were no good because they didn't help me. It was a waste of my time and money.
Okay. All right, so after Dr. Hudgens, who did you go to after that?
Okay, so after Dr. Hudgens and after Dr. Savage, that's all the information that I'm going to share with you, sir, because that's my extent of the referrals from AFC. So what I would direct you to do is inform the doctor and inform American Family Care the injury, it appears in those pictures, and they need to focus on that problem, trying to figure out what happened.
No, I understand. I feel terrible that if we missed it, then I understand that's upsetting. So, I want to make sure that, I want to make stuff right. So I want to make sure I have my story straight so that when I talk to who I need to talk to, that I can relay it effectively and,
And another thing, I talked to a lot of people at American Family Care. I had a lot of obligations that people would call me, and my calls have never been returned. Been calling them here recently for the last month since first week of April. So when do you think I'll get a call?
Well, I will push this up the chain today. I'll make some phone calls today and get some people on the phone today, and then before I leave today at 5, I'll call you back and let you know what I find out. If that's,
sure.
I haven't got a response back yet, I'll at least tell you that that's what I got.
Okay.